Esther, reporting for WORLDwrite Science Strand, and we're here in Wood Green, North London, finding out what the public think about putting a price on life.
If we consider ourselves progressive or, not conservative and not reactionary, we should always ask for growth, and we should always demand things of our government, as a right, and healthcare is a right, definitely. It is a human right to have access to free, affordable healthcare. So we shouldn't even really enter the debate about what we should be cutting.
What about smokers and drinkers? They obviously consume a lot of NHS's resources. What do you think about reducing access or making it conditional?
I don't really agree that you should cut medical support for people that have an addiction. So if somebody has a severe addiction to a drug, if that's alcohol, and they're drinking 2 bottles of vodka a day, or they're smoking 100 cigarettes a day or something, I think, they need serious help.
Is there a problem with having an institutionalized way of measuring the quality of life?
I think it's quite inhumane to say to somebody who's, say, 85 and suffering from cancer for the last 10 years to say, oh, well, he's only going to live for another 6 months, so let's not give him drugs that he's asked for, because it's not cost effective. I think there should be no cost on human life. If that person asks for drugs, they want their life to be extended till the last day they can possibly live under the capabilities of modern science. That should be given to them.
I think people with cancer and illnesses that have nothing to do with their lifestyle should get more the priority. If you abuse your body, then I don't think you're worthy so much as someone who hasn't abused their body.
In terms of rationing, obviously, I think not. I have to admit, I am a smoker. I was a school teacher, secondary school, very tough, inner city schools for 40 years. And I'm afraid to say that having a fag in the staff room at lunchtime was part of survival techniques for my generation. In terms of keeping people healthy and fit, I think society has an obligation to do so. We should demand what it takes. My measure for what is good is what do the most wealthy have, and that'll do me.
It's wrong because people need these kind of things, like they need medicine to stay alive and stuff like that. It's wrong.
No, I don't think medicine should be rationed. They need to find the resources. If they can blow up and kill people in loads and loads of countries, there are resources that they can tap into.
Do you think that being a certain weight, or being a non-smoker, or being a reasonable drinker should be a condition for free healthcare?
For free healthcare, it's easy for me to say, because I'm not a non-smoker. I drink heavily, so I can easily point the finger and say, yeah, I think I'm more responsible. But hey, people drink. Some people drink because of the challenges they face. So who am I to judge?
What about people who just eat and drink for fun? They don't have a hard life. They have a great life, but they just love a smoke. They love to get drunk, and they love fast food.
Wow, that's a hard one because. Okay, I find that difficult to answer without being judgmental. Maybe we need to try to find ways in which we can educate these people and show them ways in which they can live a more healthier lifestyle. But I don't think penalising them is going to be the solution.
The Health and Social Care Bill and the privatisation and the splitting up of the health services, where people and companies can come in to make a profit out of health. And this is part of a much bigger problem that has been going on for 20 years under Labour government, under Tory government, now under the Condemn government, where actually people's healthcare is hugely at risk. There is rationing of medicines, but there's part of that is part of a much bigger problem, which is the rationing of healthcare. And definitely there are private companies now who are not just in the wings, they're in there, they're taking over parts of the National Health Service, they're taking over hospitals, and they will be responsible for saying who can have what healthcare. And there will be more and more that if you can pay, you can get better healthcare. And that will clearly include the question you asked me: if you can pay, you will get more drugs than if you can't. And this is an absolute disaster for people, because in Britain Britain, we have had a national health service that meant free at the point of delivery, which is something perhaps people take for granted, but very soon, unless people act, that is going to disappear. I think that we need to be absolutely clear at all times that healthcare is a right, and we have a responsibility as a society to make sure everyone has access to healthcare. It doesn't matter whether you're a prisoner convicted for the most dreadful offence, it doesn't matter whether you smoke 40 a day, it doesn't matter whether you like to go down the pub in the evening, it doesn't matter what your lifestyle is. What you need is to be able to access healthcare free at the point of delivery so that you are empowered to take charge of your life, and that is what healthcare is about. And any government or society that tries to take that away is doing the most dreadful disservice to humanity as a whole.
I think it's criminal. I mean, who really has the right to decide? Those of us which have the right to live longer or without pain and so on. Undoubtedly, these medicines are made available to those who have the wealth to afford them. So these gains made by humanity in technology, biotechnology, medicines and so on belong to humanity. So to somehow say that there is someone who can decide, you know, some bureaucrat, some accountant even, who can decide whose life has the value to receive these medicines, then I think that is a criminal act.
There are some drugs available, right, which they say are quite expensive, but they have been proven to extend people's lives, but not necessarily keep them alive. What do you think about that?
You know, I think it depends how long the patient's life is going to be saved, and also the quality of the patient's life at the time. I know it's very harsh to say that if somebody's going to get a relative and who's dying, you'll want to do everything you can for them, even to get another 3-4 months. But you've really got to be sensible about this and decide whether it's worthwhile to save the money for 3 or 4 months of perhaps indifferent life, or to spend it on something else.
My mother, for instance, she has arthritis and she's 62. So have they got a particular age bracket to what's old or what's young, you know? Because if she's in need of medicine, she's going to need it. If they tell my mother that she's too old, she can't have the medicine because it's too much and they need to rationalise who they're giving it to, obviously I'll be quite angry about that. It doesn't make any sense whatsoever. I think they're just trying to cut back on money, personally, and at the expense of people's deaths or people being in extreme discomfort because they're not able to get their medicines that they wish or they would like to have or they're entitled to have, shall I say.
People who are old should be respected anyway. We are special people who are old. Because once upon a time, we have spent our life in this country. We helped to bring the country up, to bring it to light. And when we are old today, we should be looked after. Not that we'll be put aside for forgotten. That is totally wrong for the government. Because the government's forgetting that he or she will be old one day. And where would they be? Would they like to be pushed aside? No.
What do you think about the government denying access to treatment and medicines for people who smoke or drink too much or are obese?
I think that these people should still have the right to receive treatment. However, when they do, there should be a covenant from them to actually support that treatment, which means making lifestyle changes. And if those people are unwilling to do that, then I think then the treatment should stop, because then it's obviously their choice not to cooperate with what actually the health would require.
You know, putting a price on people's life, I mean, life is priceless, right? So to really, you know, say that we shouldn't get healthcare because we smoke or we might drink, I think it's disgusting.
It's a 50-50 opinion, but I think somehow, you know, they have to pay for the medication, so rationing is sensible, I think. Makes sense to me, yeah. If we're objective, if you think about it, where is the money coming from? Where is the money going to come from for people to have more drugs? I don't know, because every individual case is different, but if you look at the whole nation, where are you going to get the money from to be able to afford all these drugs?
How do we decide who gets to live and who doesn't get to live and whose life is valued higher than someone else's?
I think that the government doesn't go, oh yeah, you can't have this drug. Before they make that decision, they do a lot of research. I know that the NICE guidelines, they look at the percentage of people that are going to benefit or the quality of life people are going to have if they do take that drug. And if it's not, if it doesn't make, I don't want to say this word, but if it doesn't economically, if it doesn't make sense, then if you're going to lose out more, then why should they do it?
No, I think it's completely unethical, immoral that economic value is attached to a person's life. I mean, I have been in a situation myself, when, I mean, as a family, you have to take a kind of stand that, if someone is suffering from a life-threatening disease over a period of time and they're on life support, then, you have to take that kind of thing. But I think this should be a decision that should be taken by the patient's family and their loved and dear ones, not some bureaucrat sitting in Westminster.
What about the argument that if we give this expensive treatment to this one person, we won't have enough money to give it to these other 10 people because we've got a budget at the end of the day and we need to stick to it?
I don't believe them. Personally, I wouldn't restrict it. If someone deserves, if it's a week, a day, an hour, I think that's something that their family should have, and it's something that everybody in the country is paid for. I didn't even know that they could actually restrict it or say, no, you can't have an extra life, an extra week to spend with your family, No, I don't think that's acceptable.
So what do you think about QALYs in that case?
I can't understand how you could put a price on life. I just don't get that. It's priceless, in my opinion.